When I'm doing clear cornea cataract surgery, I use the ReSure in a number of different ways. Number one, it's a backup for if there's a leaky incision. A lot of patients will ask, Doc, are you going to use a stitch on my eye? I heard a friend of mine had a stitch and had to get it taken out, and they get really worried about this stitch in their eye. And so, since ReSure Sealant's been out, I haven't placed any stitches on any cataract surgery. So I can look at a patient in the eye and say, Mrs. Jones, you're not going to have a stitch in your eye. Chances are that it's a self-sealing incision. But if we need to, there's a sealant I can put on the incision at the end of the case that ensures that that incision is going to remain tight. And something about that security that we give that patient, it gives them confidence that they're in good hands and they're going to have a good outcome. So, the ReSure Sealant gives, it's a great backup for any case. So I no longer need that stitch during surgery. But as far as routine uses of ReSure Sealant, I often use it in accommodating lenses. With an accommodating lens, it's very important that that anterior chamber remains full, and there's not a collapse of the anterior chamber through a wound leak or egress of fluid out of the incision. So with the ReSure Sealant, I know that that anterior chamber is going to remain rock solid after the case, and that lens is going to stay in the proper position. If the incision were to open, the lens could move, and you could have a adverse outcome. So we use the ReSure Sealant in a lot of the cases where we're doing accommodating lenses.